Why am I urinating every 2 hours? Possible causes. It's important to note that some people may require a bathroom break every 2 hours before we discuss the causes. You will need to urinate more frequently as you age, and it's common to occasionally get up in the middle of the night to use the restroom. For example, it's normal to wake up once a night in your 40s and 50s to use the restroom. It may be twice a night in your 60s and 70s and 2 to 3 times a night in your 80s and beyond. On the other hand, nocturia, the term for frequent nighttime awakenings to urinate, can cause sleep disturbances and may be a sign of a medical condition like edema, heart illness, or a sleep problem. Sometimes, kidney discomfort coexists with increased frequency of urine. We refer to the dull aching in your back, stomach, or lateral sides as kidney pain. Many disorders can cause kidney discomfort. Urging to pee every 2 hours or more is another common side effect of the majority of these illnesses. However, discomfort and frequent urination may not necessarily be linked to renal problems. Urinary tract disorders are indicated by discomfort at the beginning or throughout the process, whereas bladder or prostate problems are suggested by pain following urination. Because the bladder, prostate, and urethra are so near to the kidneys, these problems may be linked to kidney discomfort. Whether you feel the pain or not, there are multiple reasons for frequent urination. These can be due to kidney or bladder problems or non-renal diseases. Now, let's see the possible causes of frequent urination. 1. Urinary tract infection, UTI. Urine is transported from the interior of the body to the outside by the urinary tract, which runs from the kidneys to the urethra. Urine is created in the kidneys and then transported to the bladder, where it is stored via the ureters. Lastly, the urethra is used by the body to discharge pee. One of the most prevalent causes of frequent urination is an infection of any region of the urinary system, which is also painful. It might be a bladder infection, also called cystitis, urethral infection, or kidney infection, sometimes called pyelonephritis. To put it in perspective, an infection causes inflammation, which can irritate the urinary tract's lining and increase the need to urinate. Additionally, your body may produce more pee in an effort to eliminate the germs causing the infection. In addition to frequent urination, additional symptoms of urinary tract infections, UTIs, include discomfort in the lower abdomen or groin, bloody or foggy urine, dysuria, or pain during the passage of urine, nausea, fever, or chills. So far, are you having fun with our video? If so, kindly leave us a like and we'll create more stuff along these lines. 2. Kidney diseases. If you feel as though you need to go to the bathroom more frequently, particularly at night, this might mean that there is an issue with your kidney's ability to filter urine. More precisely, you could have a kidney ailment, and it could be connected to a problem with the filtration mechanism of the kidneys. By producing urine, your kidneys function as the body's natural filters, assisting in the removal of waste and extra fluid. Your kidneys typically perform a fantastic job of reabsorbing water into the circulation, which concentrates urine. However, the kidney's capacity to concentrate urine is reduced if they sustain injury. As a result, individuals produce more diluted urine because they are unable to reabsorb water as well. Because of the increased volume, more frequent urination is required. 3. Bladder issues. When you urinate frequently, it can sometimes be due to problems with the bladder. The occurrence of bladder stones is one typical problem. Urinary tract discomfort, lower abdomen pain, and trouble peeing are just a few of the symptoms that these stones can cause. These symptoms may make it difficult for you to completely empty your bladder, which may result in frequent urination urges. Interstitial cystitis, another name for bladder discomfort syndrome, is a worrying problem. People with the chronic illness often have lower abdominal pain that lasts for weeks at a time. Urging frequently is a common side effect of this discomfort. Although the precise etiology of this illness is unknown, it may be related to an immune system malfunction, much as autoimmune diseases or allergic responses. Sometimes frequent urination can signify a more severe issue, such as bladder cancer. This cancer can also present with lower abdominal or back pain and blood in the urine. 4. Urethral stricture. Urine exits the body through the urethra, which is the last segment of the urinary system. Urinary stricture is the term for the condition when it narrows as a result of wounds or infections. Because you can't entirely get all the pee out in one go, this narrowing can make it difficult to urinate, frequently necessitating many runs to the bathroom. The next reasons on our list might not be directly related to a urinary tract condition, but they can still be common and worrisome. 5. Prostate problems. Benign prostatic hyperplasia, or BPH for short, is a prevalent condition that affects the prostate gland in men and is another major explanation for the increased frequency of urination. The gland, which is situated just below the bladder, contributes to the production of semen, a male fluid that contains sperm. This gland frequently enlarges with age in males, resulting in problems related to the urinary system. An increase in the frequency of urination and problems regulating or holding pee are the most typical symptoms of BPH. In other words, much like with urethral stricture, an enlarged prostate can impede the flow of urine out of the bladder, leading to incomplete emptying and, as a result, frequent urination. 6. Vaginal issues. We've talked about the connection between increased frequency of bathroom visits and infections of the prostate or urinary system. Likewise, infections of the vagina, sometimes called vaginitis, caused by either yeast or bacteria, can also make you feel the urge to urinate more frequently. Cystocele, or anterior vaginal prolapse, is another potential reason. This is a condition in which the bladder deviates from its usual position and presses on the vaginal wall. This occurs as a result of weakening or stretching of the pelvic floor muscles, which support the bladder and other pelvic organs. It might give the impression that you need to urinate more frequently since the bladder is displaced and not adequately supported. However, why do cystoceles happen? Pelvic floor weakness and bladder displacement are frequently caused by severe weightlifting, repeated delivery, and persistent constipation. Cystoceles can result in pelvic pressure symptoms in addition to frequent urination. When to see your doctor? As we discussed earlier in the video, not all episodes of frequent urination warrant alarm. There are several indicators, nevertheless, that you should be aware of. Seek medical attention if your quality of life is being negatively impacted, your sleep is being disturbed, or your frequent urination is coupled with any other symptoms we've covered. Fever, side or back discomfort, bloody pee, pain when urinating, or an inability to hold pee are some of these further symptoms. To determine the underlying reason, your healthcare practitioner will probably take a medical history, perform a physical examination, and prescribe testing such blood or urine tests. We hope this information helps you.